We will talk about supplements for joint pain. When we say joint pain, we usually mean two conditions. First is osteoarthritis, and second is rheumatoid arthritis. Osteoarthritis is wear and tear of joints, and it's strongly related to age, especially after age 14. And rheumatoid arthritis is autoimmune disease, and it's related to inflammation. That's why it can occur almost at any age. So when we say inflammatory joint disease, we usually mean rheumatoid arthritis, and osteoarthritis is wear and tear. And first supplement we should mention is glucosamine. Glucosamine is considered safe for long-term use, and it has moderate effectiveness. Moderate effectiveness in case of knee osteoarthritis. Glucosamine is natural component of cartilage. Cartilage cushions our joint, it protects our joint, and its component is glucosamine. Glucosamine shows moderate effectiveness, means that it improves pain and it improves mobility of the joint, but we have mixed results in the studies. It means that some studies shows no effect of glucosamine. It's not better than placebo in some studies. That's why. But of course, we have many studies where glucosamine shows effectiveness. That's why we have mixed results. Recommended dosage of glucosamine is 1.5 grams daily, and for effect, intake should be at least 6 weeks or more, and usually people intake this for months or sometimes for years, for 2 years for example, or for 3 years. Usually it's safe, it's considered safe, and intake route is capsules usually, or pills. Anyway, it's oral intake route. There is some local topical applications, but effectiveness is under question mark of such intake. So most effective way of intake is oral route. And chondroitin is another component. Chondroitin is usually used alongside with glucosamine. They are used together in many cases, combined, glucosamine and chondroitin. Both of them are natural component of cartilage, and chondroitin can moisture our joints because it can retain water in the joint. That's why it's important component. And also chondroitin shows effectiveness to prevent breakdown of cartilage. It can moisture cartilage, it can reduce inflammation, and optimal daily dosage is 1000 milligram or 1 gram per day. Also, chondroitin is used for several months and sometimes for several years. Also, these joint supplements usually are used for prolonged period of time because the effectiveness is low usually, and they need time to show effectiveness. And also these problems such as osteoarthritis and rheumatoid arthritis are chronic problems, and glucosamine and chondroitin are more effective in case of osteoarthritis, and in case of rheumatoid arthritis results are very mixed. That's why usually they are not used in case of rheumatoid arthritis. They are used with age-related osteoarthritis, and they have some degree of effectiveness. Another supplement, third supplement, is omega-3 fatty acids. Omega-3 fatty acids are well known for their anti-inflammatory action, for their cardioprotective action, for their improving cognitive function. So they are very popular supplements, and they have effectiveness in case of arthritis. Also, especially they are effective in case of rheumatoid arthritis. So Glucosamine and chondroitin are effective in case of osteoarthritis, when we have repetitive movements, when we have wear and tear, when we have age-related osteoarthritis. Glucosamine and chondroitin are better when we have rheumatoid arthritis or inflammatory arthritis. Omega-3 is better because it has anti-inflammatory action. Also, it reduces pain, it improves mobility, and dosage is 1 to 2 grams per day, possible more also, and intake should be more than 6 months usually to have some important effects on joints. Here's questions about safety of omega-3. If it's safe, usually it's safe, usually no serious side effects or adverse effect, but we should mention about bleeding risk. There is a very small risk, but it still exists, especially if person intakes other blood thinners. Also, curcumin is another popular supplement. Curcumin also has anti-inflammatory action, and it can be used during rheumatoid arthritis also. And another fifth supplement is vitamin D, because vitamin D deficiency can cause joint pain, even bone pain. So vitamin D deficiency causes joint and bone pain. That's why intake of vitamin D can improve condition. And vitamin D is important not only for joints but also even for mood regulation, and for our calcium absorption, and for bone to prevent osteoporosis, bone weakness, to prevent bone weakness in older ages. That's why vitamin D is important. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.